And good morning. I'm Dr. Artie Majan, CEO and founder of the Deuk Spine Deuk Joint Institute. It is October 12th, 2023. Our patient here has painful facet joints. Facet joints are the second most common cause of neck pain. They account for about 10 to 15% of neck pain. That's chronic. The disc is the most common cause when you have a herniated or degenerated disc. We're going to be fixing her facet joints on the left side at C5-C7, and she has pain when she rotates her head to the left, and the pain is directly over the facet joints. So we're very confident this is part of her problem. We're also going to be fixing 2 discs in her neck as well later on. All right, we're going to get started. The first thing we're going to do is use our X-ray machine to localize the proper facets. Our patient is asleep. She's laying face down. So I'm going to advance our needle to the facet. Hold on. Strange. All right, shot. Great. So we can see the T1 on my side. There. Show us the pedicle T1. There it is. 7 above, 7. Yep. And then 6 would be about there, then 5 is there, and 4 is a little bit above. So we need to be a little bit more north, which I can get us to. No problem. Coker or shot. All right, so let's see. That's one more shot. So T1 7654. It looks like 4 to me. You agree? I agree. So we're going to do that one down. First, I'm going to give some numbing medicine to make it a bit more comfortable for her as we do the procedure. She is asleep, but people have responses anyway. They respond with parts of their brain that are not related to conscious awareness. Their brain stem, for example, receives lots of sensory inputs from all over the body, and those inputs never make it up to the cortex, which is your consciousness. Okay? Any sensory information that doesn't make it up to your cortex, your cerebral cortex, which is the outermost layer of your brain, will not be perceived as at a conscious level. It will only be subconscious. And believe it or not, a lot of our brains are wired to receive and process subconscious information. So far, so good. I'm making my way down to the facet joints using my probe. I'm using the X-ray machine to guide my probe. I'm a little too medial there. I want to go more lateral shot. All right, that's pretty much a perfect spot for me. I just got to make sure I'm on the bone. That's the most important thing in treating these nerves, is you want to be where they are. You want to be on the bone. So T1 7654. It looks really good. I'm a little too medial. I want to be a little bit more lateral shot. All right, that's too lateral. I want to be a little bit more medial. The key is you want to be on the bone shot. I think I'm pretty darn, that's like the perfect spot. I think I'm getting caught up in the fascia a little bit. There's bone right there. Shot. Definitely on the bone there. So the nerve to her facet joint, I feel myself right on the edge. You want to be right on the edge. It feels like I'm on the edge there. So the key here, folks, is to burn the pain nerves on the edge of the lateral mass in the cervical spine. And that piece of bone right there is the lateral mass. And I'm going to march my way down her lateral masses. Try to stay towards the lateral edge. That's where that branch comes up. It comes from the front, where the neuroforamen is. And it actually starts heading backwards towards the facet joints. And then it innervates the actual facet joint. She's doing great. She's asleep. Shot. All right, so now I'm at the lateral mass of, let's see, T1-7-6-5. Shot. I'm going to have to reposition in a minute. That's the lateral mass of 5. I'm going to come out a little bit and slide down. Shot. And honestly, it's a tapping movement and sliding movement to get these things. You want to do as little trauma to the muscle as possible. The muscle is right back here. It runs along the back of the spine. We're going through the muscle to get to these joints. And you want to try to minimize the trauma to the muscle, shot, because that's really what's going to hurt after the surgery, is the muscle. So I'm trying to be gentle as I do this. All right, I'm going to come out and I'm going to reposition. So that's T1, that's 7, I'm on 6. I need to go down one more. Knife. Any questions?
No questions.
We're almost done. I need about 2 more minutes. Shot. All right, nice. So we're gonna, I'm right on the bone. Again, I'm gonna really sever, which is to cut, the pain nerves here that are running along the back of the spine. Shot. Perfect. That's our last one. That's 7. All right. So we're going to wrap this up in about 10 seconds and we'll be done. Shot. That's beautiful. Just one more shot.
We have a comment from Cynthia on YouTube. Hi, I'm using my wife's YouTube channel.
All right, I'll come answer the question. Give me 1 second. I'll come there. We're done. Let's show them the incision. Show them the incision, Sanjay. Okay.
Copy that.
You see this? 3 millimeter incision. Can you see it?
Yes. Yes, we can.
3 millimeter. So it's a tiny incision, and through that incision I go in and I destroy the pain nerves to the joints on the left side. All right, let me come over there and I'll answer the questions, okay? Well, we're gonna now flip the patient over. Take your time, guys, okay? No rush, and I'll be right back. So let me come over there. Why don't you show us a testimonial for the Deuk laser disc repair, which will be the next procedure we're doing on her.
Copy that.
Sanjay, I need to hear a countdown.
Playing educational video in 3, 2, 1.
morning, I'm Dr. Deuk. It's December 9th, 2022, and I have with me one of my patients who traveled from out of state, Texas to be exact.
Yes, sir.
And he is suffering with neck pain, and I'll let him tell you a little bit more about his symptoms, but he had herniated discs in his neck along with degenerated disc. We just repaired those yesterday, less than about 12 hours ago.
Yes, sir. Yes, Doc. Yeah.
You're here now on post-op day 1. It was outpatient, no hospitalization. You stayed at the hotel. You're back this morning, and how do you feel?
I feel great, Doc. You know, I just want to thank you right off the bat for you and your team for basically giving me another lease on life. I mean, the back of my neck, the tops of my shoulders. I had pain all the way down the back of my arm, and my elbow, and then also I had no grip. And today, it's all back. I just, you know, it's just a game changer. His procedures, because I've had fusions in the past, like 15 years ago, and those fusions, you don't want to do those because they just give you adjacent disc disease, and I have that problem right now in my back, and Dr. Deuk is going to fix it next week. So I'm very looking forward to doing that.
We'll be seeing him again next week after his back is fixed. But you broke it up into 2 procedures, and we get people all the time asking us, oh, can I come there and get my neck and my back fixed? Yes, you can. We'll probably do it on separate days. So you got 3 discs repaired yesterday. You can
Yes, sir.
actually see right here in this video footage how small the incision is, tiny. And I was in there endoscopically using a laser to clean out the tear and remove the small herniations. And now here we sent you home an hour after your surgery, and here you are back today. And how much of that pain did we get rid of?
All of it, Doc.
100%.
I mean, 100%. And I mean, the doctor did. They did surgery on 3 different levels, and through a really small hole.
4 millimeters.
Yes,
4
Doc.
millimeters. Incredible.
There's no stitches. It's just a Band-Aid.
Yeah.
You know, that's crazy. You know, if you have a fusion for three level fusion, I don't know how long that would be, but it's
it's
terrible.
about that long
Yeah.
for a 3-level fusion. And then of course you'll have swallowing trouble for months,
Not
and
good.
then you'll have pain, and you'll be on narcotics. Are you on any opioids or narcotics?
No, Doc. Last night I went home and to the hotel, and I just took a Tylenol PM, and that's all the medication I've taken since the surgery.
Yeah. So with the Deuk laser disc repair, you don't have to worry about getting addicted to painkillers because there are no painkillers. Literally a Tylenol, and that's it, because it's so minimally invasive. Far better than ACDF, far better than any other cervical type of surgery. Well, is there anything else you want to tell your fans out there before we wrap this up?
Yeah, I just want to let my parents know, and my 10 younger brothers and sisters, if you're watching this, if you have back issues, you need to come see Dr. Deuk, because he is one of the only people in the world that can do this procedure, and it is a game changer, and it's well worth it. At least give him a review. He'll do a free MRI review for you. It's just do your research. Go to his deukspine.com, look at his website, and just do your research and give yourself a chance to do the right thing.
Well, thank you. And yes, now I'm the only one, but someday there will be another one
You hope.
who will be doing these
Yeah.
surgeries,
Yeah.
and probably better than me.
Okay. Thanks, Doc. Appreciate
Thank
your
you,
help.
sir.
Yeah.
We'll see you soon.
Yeah.
All right, welcome. We've just completed our Deuk plasma rhizotomy. Our patient cervical spine is suffering with pain. The pain was coming from 2 places, 2 discs that we're going to fix next, but also the facet joints, which are these small joints in the back of the spine. The facet joints account for 10% of people's pain when they have chronic pain in the neck. When you injure your disc, you also injure your facet joint, and the question is, will it become painful or not? It's just like if you have arthritis in your knee, you may have pain, you may not. A lot of people have facet joint injuries with arthritis of the joint that they don't have pain. So we leave those alone. But basically what I was doing today was I was doing what's called a rhizotomy. It's a Deuk plasma rhizotomy. It's a technique that we developed here at Deuk Spine. And I came down to the lateral masses here, and I basically rhizotomized and destroyed the pain nerve by moving my probe. And I did 2 movements, or 3 movements, 3-dimensional. I went up and down, I went medial and lateral, and I went hopping. So kind of like just to make sure I'm burning the pain nerve in every place it could be. The tip of my probe, Deuk plasma wand, is 5 millimeters of burning surface. So sometimes the nerve may be thicker than 5 millimeters and you have to hop a little bit off the bone. So we burn the C4, 5, 6, and 7 and destroy the nerves there. There was no bleeding. As you could see, it's pretty much bloodless surgery. And the treatment is specifically for facet joint pain. You have to know which facet joints you're treating. You have to know that ahead of time. I knew that because I've done a lot of spine surgery, so I knew that it was the number 4, 5, 6, 7 on the left side. Now she's having a little bit of right-sided facet pain, but it's very mild. And we decided that we're just going to wait and see how she does with this procedure, and that maybe that pain will go away with the disc surgery. We'll see. But we have a question or comment?
Yes, we have a comment on YouTube. It says, my name is Stuart. It sounds like the patient's heart has a premature atrial contraction and some of those beats maybe not. The heart rate sounds off.
Well, I appreciate your comments on that. I am not a cardiologist, but we do have a very highly qualified anesthesiologist monitoring the patient. You could be right, but the patient was stable through the whole surgery. They remained hemodynamically stable without any significant issues. So thanks for paying attention.
No further questions.
And yeah, we're going to end the broadcast and we'll come back in about 30 minutes with the anterior cervical Deuk laser disc repair.